Cancer is something that affects us all. It doesn't matter if you're rich or poor, if you're black or white or Asian or other, it doesn't matter where you were born. And because of that, I think it's something that we all have a stake in, and it's something that we can all come together to fight and try to beat.
Well, hello there.
Hello.
We missed you last night.
I know. Good to see you.
Good to see you.
My area of clinical expertise is in melanoma and lung cancer, and my area of research is in T-cell therapies.
How do you feel it went?
Yeah, I'm exhausted, but I guess that's good because they say if your T cells work, then you should feel like you have a flu.
Yes,
Yeah.
yes, it definitely.
For a long time, all we had to treat cancer was surgery, radiation, and chemotherapy. And the problem is cancer is a living cell in your body, a living group of cells in your body that are constantly changing, and they can constantly outmaneuver the things that we try to give it. And so the way people describe immunotherapy is that it's a living treatment because you're adjusting people's immune system cells, you're either reprogramming their cells to go back into their body, and those cells are living in the body and surviving and continuing to work and adapt to the conditions in your body. And so we're seeing a lot of successes that have exceeded what we've seen in our traditional treatments.
And take some breaths in and out.
Okay.
So T.I.L therapy is a specific form of T-cell therapy. If we take the patient to surgery and remove part of their tumor and take it into the lab, we can look at what T cells have actually been drawn to the tumor already, and we can grow those out, and then we can test them and select which ones are able to fight their cancer the best, and then grow those out some more, and then infuse them back into the patient.
So basically what we saw on scan is considered stable disease. We don't
Immunotherapy
see
is
very
all over
big
the press right now, and there's a lot of excitement about how immunotherapy is really changing the field, and for many patients it seems to be curing their cancer, getting rid of it. At least that's our hope. However, the reality is we still have a long way to go.
Sometimes we do see things get a little bit larger as the T cells go into where they're supposed to be.
We don't know yet if these T-cell therapies are going to be effective against lung cancer, breast cancer, colon cancer, and that's what we have to find out next, and we can only do it through clinical trials. And from the patient's standpoint, the way they get access to these is through clinical trials. And so we want to be able to offer these treatments that we think have a real potential to help them. We want to be able to offer them to as many people as possible.